There are some people that treat typhoid. You know that one they call typhoid? There are some people that treat it regularly. But they are drinking good water and they are not eating spoiled food. I mean, they control. You look at it, they manage what they eat. They control, they cover things. So where is these infections coming from? I trust tests most times. When you run tests, you find. So some people, they keep finding something and keep taking drugs and keep treating things. Why not realizing that the main problem is the bags they are carrying, the undealt, unresolved emotions in their lives. I've done a practicum in a hospital, and one day we were called to talk to a patient who wasn't responding to treatment. The doctor in the hospital called us. I was talking to, I think, people in the premarital section. They came for tests, something like that. So my colleagues who were in the ward came to call me that the doctor is calling for attention. So later I went to see the doctor. He referred us to one patient whom he said wasn't responding to treatment. And the doctor knew that it is a psychological issue. That's why I'm bringing it up. The doctor knew that it is a psychological issue. So I went and the man just looked at me like this and removed face. So I was now talking to the caregiver that was beside him. I think his sister also. I was discussing with his sister about it, like trying to know what is wrong and all that. I was asking things. So as I'm talking to the sister, the man now responded. The sister responded wrongly. And the sister gave me wrong information. So the man now opened his mouth and corrected the sister. Then that gave me opportunity to talk to him. And we got talking. We talked for like 15 minutes. And then he accepted the doctor should come and treat him. The doctor came and gave him injection. He didn't allow the doctor to choke needle, like do anything. He carried drugs like this. He can slap your hand and and he wasn't mad though, it was normal. Bring drugs and take. You will slap your hand and take the drugs down. So some doctors actually understand the psychological dimension. And they refer their clients, they refer their patients to where this kind of stuff can be given. But the point we are making is that physical illness can be as a result of emotional baggage. And then emotional baggage can also cause physical illness. That's the point. Alright, the inferiority. You see someone that is so inferior. I mean, having the sense of inferiority most times is connected to something that happened in the past that the person has not dealt with. Maybe someone said something. Let me give you a typical example. In primary school, someone answered question wrongly and people laugh. Do you get the point?
Yes.
Do you know it has a way of making the person not to answer question again up to university, even up to masters and PhD. Yeah, this is a fact that I've seen. It's not true, right? That's the problem we are discussing. The problem is what we are discussing. No, I mean, he gave a wrong answer to something. Some teachers are funny now. He can say, why this thing is wrong? You know, people laugh. It is how something is wrong, so wrong that people laugh. Some people are not like that. And again, the family the person is coming from, you don't even know what is happening at home. Whether there is any sense of encouragement or motivation for this person at home. You know, as a young child, you have to have a way of making the child believe he is somebody that is motivated, that he can do it, he can take a challenge. If he fails in anything, you have to make the child believe young enough as a young child, long enough as a young child, to believe that the mistake doesn't mean is nobody, is nothing. And then look for those good things in his life, his or her life, and appreciate. You don't know what this little thing, oh, well done, this is good. You don't know what it does to people as they are growing up. So imagine a child that do not receive it, do not meet that need in his life, is now coming to class, and then you people are laughing at the little effort that the child is making. Little efforts the child is making. It may be the reason why that child do not talk in the public, or do not answer a question again, saying that I'm nothing. As he's walking, I'm nothing. Every other person in the world is better than me. Do you understand what I'm saying? Some people, this is the state of their mind. This is their life. That everybody in the world is better than them. Some people will not, everybody. Of course, this is also connected to people's personality and temperament. Then it's also connected to people's upbringing. What happened at the childbirth? The child is still acceptance that they give to the child is important. That's why those children that are born in families, maybe they expected a particular gender, then a particular gender is born, and they have a way of treating